Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. Question came across my feed, actually on two different feeds. What if? Two big words. What if I had more time to think about what was happening, what needed to happen? So there are two different areas that I can answer that question. One, of course, is with my diagnosis of cancer, Hodgkin's lymphoma, or when I was faced with my first late side effect from my treatments requiring heart surgery. So I'll answer the cancer question first. What if I had more time to make my decision? Well, I'm kind of Buddhist with my thinking. I don't spend a lot of time worrying about the whys, the whats, the whens, the what ifs. But when it came to being diagnosed with cancer, particularly Hodgkin's lymphoma, I was encouraged by the doctor that, the sooner we can get started on treatments, the better. Time is important. The worse you get, the harder it will be to treat. So there wasn't really a whole lot of time given for that. What I knew was that Hodgkin's lymphoma had a high treatment rate, a high remission rate, but it also had a nearly impossible fatality rate. It was almost guaranteed. You either go through treatment and have it be successful, hopefully, or that's it. Game over. So there wasn't really that much to think about. Now, had I known the risks from the treatments as far as late side effects, I don't know. Because these late side effects that some cancer patients deal with, usually decades down the line, aren't guaranteed. Not everybody gets them. So it's kind of a risk. You either take the chance on it and enjoy many years of survival, or you just end it really quickly by not taking any treatment. That was guaranteed. The other wasn't. So I don't know that that would have had any impact on changing my mind, giving me more time to think about it. As I wrote about in my book, I spent 4 months in denial of being diagnosed with cancer. So I had already wasted a lot of time, uh, you know, getting treated. So as for my heart surgery issue, again, I spent 4 months with the symptoms of chest tightness. So, regardless if you have any kind of cardiac health problems, okay, if you have that chest tightness, get to the doctor, regardless if you've had cancer treatments or not. Okay, that's a big tell right there that you need to see somebody. Now, from there, what if I had more time to discuss with the doctor what to do? Because what happened was 36 hours later, I was on a table having emergency bypass surgery. So, as you can see, that's that nice, big, wonderful scar going up and down on my chest. Okay? Now, again, I was under the influence of anesthesia when they told me how bad I actually was, because I had just gone through a catheterization. They knew I was dealing with a blockage, just not how bad it was. So when I was coming to, it was explained that I had what was described, and I have to be careful with TikTok. Um, Basically, it was an end game scenario as far as my health goes. Most people don't survive it. But because I was in the hospital already, they were aware of the condition. They had time quickly to fix it. I didn't have a lot of time to think about it. As my cardiologist put it, it was just a question of when, not if, I was going to be unalived. So, what if I would have been given more time? Well, initially, when I first went in for that chest pain complaint, I stalled. I walked out of the office. I said, I got things I got to do. much to his protest, saying, look, we know you have a blockage. Okay? We need to get this done now. And still, I walked out. Now, I kept my word. I came back in, the next day, and I allowed them to do that catheterization on me. And that's when they found out how bad I really was. And it was really foolish that I took the extra time because I was being stubborn. So I really didn't have any choice or any advantage to if I would have had more time. I could have lost my life. So I'm of the old school and the mindset that what your doctor offers you is what's best recommended. Now, I always recommend, if you have time, seek out a second opinion. There's absolutely nothing wrong with that. A lot of times they can be done fairly quickly. They may or may not involve an office appointment. They may be able to do it via records being reviewed or whatever. And your main doctor treating you shouldn't have a problem with getting that second opinion. If anything, they want to confirm what they suspect. But as far as taking time to consider, no, I wouldn't take any more time, and I wouldn't have changed anything. I'm here 37 years post-cancer. I'm here 18 years post-open heart surgery. So I took all the time that I needed. I didn't need more time. I made the right decisions. Until next time, this is Paul's Heart.